Hi everyone, I am Stephanie with 9Health. It is Mental Health Awareness Month, which our mental health is probably more important now, than ever, really, with a lot of us at home and this pandemic going on, a lot of uncertainty. We really want to focus on our mental health. We're working with the state of Colorado, the Office of Behavioral Health. I have several guests joining me this morning. I'll quickly introduce them, and I have some questions to ask. We'll also take your questions about mental health. These experts really have information on resources and tips to relieve anxiety and stress during this time. So please feel free to ask us your question. Before we get started, I do need to mention that it's also Giving Tuesday, a special Giving Tuesday. Community First Foundation is helping individuals support Colorado nonprofits during this unprecedented time of need. You can give where you live, support Colorado's nonprofits like 9Health. We are a 501c3 nonprofit, and we need those donations to help us keep going, especially during this time. There are many ways to give back and ways to support 9Health. Visit coloradogives.org/9healthfair. I'll put the link in the comments. You can also click on that as well. I'm joined now via Zoom by Colorado Lieutenant Governor Diane Primavera, Robert Worthman, he's Director of the Colorado Office of Behavioral Health, Tracy Johnson, she's the Medicaid Director for the state, Cigna mental health professional Jason Youngblood, he joined us on our mental health town hall a month and a half ago, and we got some great tips from him, and also 9Health expert Dr. Paul Coley, who's a cardiologist, but also an expert on preventive medicine, internal medicine, so she's really our expert on all things COVID because she started at 9 News right when all this started ramping up. So thank you all for joining me this morning. First, Dr. Coley, can you give us an update on COVID-19 in our state today?
Yeah, it's been a big week for our state with respect to COVID-19 because we've transitioned this week from the stay-at-home to the safe-at-home orders. And that's really within the context of a lot of other states across the country doing similar things. So 42 states this week are actually relaxing their stay-at-home orders. And we're really trying to shift into kind of the next phase, so to speak. There is, however, some need for concern and a little bit of pause that we ought to exercise because a new model just came out. The IHME model today was revised. Now, initially that had estimated 60,000 deaths by early August. And now they've revised those estimates to 134,000 deaths. And that's really incorporating a few new factors. The first is the states that are opening up and relaxing some of these stay-at-home orders. They have also actually built into the model the effects of weather and temperature, which at this point are scientific and not necessarily proven, but they've actually added to the model how weather can slow down the spread of the virus with the virus decreasing its transmissibility with every few degrees change in temperature. So based on these new projections, they're estimating 134,000 deaths by early August. Similarly, a Johns Hopkins model was also released today, and that model is estimating about 3,000 deaths a day by early June. So certainly sobering warnings, but the take-home message is really that this continues to remain within our control. So if we continue to practice that social distancing and really do many of the things that we have been doing, we really are going to be able to keep those death numbers as low as possible.
All right, thank you for that update. Again, everyone, it's Mental Health Awareness Month. We're focusing on your mental health all month. We're working with the Colorado Department of Human Services, the Office of Behavioral Health, and connecting you with a ton of experts to get your questions answered. Today, we're kind of doing a kickoff, doing some general information on resources, tips for relieving anxiety and stress during this time. So please ask your questions if you have them on Facebook. Before we get to some of your questions, I have a few questions I want to ask. We're going to start with Lieutenant Governor Diane Primavera. Thank you so much for joining us. Can you first talk about what Mental Health Awareness Month is?
Sure. Well, thank you. And first of all, I want to thank 9Health for hosting this panel and sponsoring the Mental Health Awareness Month series throughout the month of May. Mental Health Awareness Month aims to destigmatize mental health conditions. 1 in 5 Coloradoans has a behavioral health condition. So whether that's substance abuse, substance use, alcoholism, or some other disorder or mental health condition like anxiety, depression, or other serious diagnosis, we all know that stigma is a big reason why people forego treatment. I have a brother who had a mental health condition, and that was part of the reason that he didn't seek treatment either. So by sharing our stories about mental health, we can start to reduce feelings of shame and empower more Coloradoans to seek help.
And tell me a little bit about how the administration has prioritized mental health.
Well, our administration has focused on lowering costs and expanding access to quality health care. So part of that is mental health, which is just as important as our physical health. And in addition, we recognize the intrinsic connection between all aspects of health. So we established Colorado's first behavioral health task force, which is reimagining our system and how we deliver care in Colorado. Our current system is convoluted and complex at best, and so the goal is to make it easier for Coloradoans to get the help that they need when they need it most. So last week, Governor Polis also announced that the task force will have a special assignment, a committee related to COVID-19, to look at how the virus has affected Coloradoans' behavior and how we can better prepare for the future with COVID-19.
Yeah, and I think, it really is affecting a lot of, people's mental health and maybe, exacerbating some mental health conditions that maybe were already there. Robert, you're the director of the state's Office of Behavioral Health. Can you talk about how your office supports Coloradans to promote mental health?
Yeah, so the Office of Behavioral Health, the Colorado Department of Human Services, we work in partnership with the Department of Healthcare Policy and Finance, which is Medicaid, to provide funding for behavioral health services throughout the state. The Office of Behavioral Health specifically is responsible for providing funding around under or uninsured Coloradians, and then as well as overseeing 2 state psychiatric hospitals and the state psychiatric mental health crisis system. The Colorado Crisis Services is what it's referred to as, which is important in times like right now where individuals need to know that they have someplace to go for their concerns.
And talking about right now, how do you think the COVID-19 pandemic is affecting our mental health?
Well, it's just adding an additional layer of stress to the stress that many individuals face already. It's really impacting folks who are already struggling or were not struggling before with sleep, substance use, concentration, interaction with others. It's become it's become impairing in people's ability to sort of live their lives. And when we see that sort of exacerbate people's already levels of anxiety and fear, it takes it to another level. And we really are encouraging folks to call and get help. If they need help, they should get help right away and call Colorado Crisis Services at 1-844-493-8255.
Yeah, and I can post that information and link in the comments as well so that people have that information. Dr. Palacoli, just speaking about resources, can you tell us a little bit about the resources that 9Health offers?
Yes, so there is a free mental health screening available on 9Health, and I will echo what everyone else has said, which is that this phenomena, which has actually been termed coronaphobia, is actually, a disease in and of itself. And it's really a combination of many of the effects, the mental and the physical effects of this epidemic. And we're talking, all people of all ages being affected, all the way from children to adults to even healthcare professionals, as we saw. We lost a physician last week to suicide in New York City. So it's a real phenomena. And I think it's okay to feel this way. But the most important thing is, if you do feel this way, then to seek those resources. So the 9Health Fair does have a mental health, anxiety, and depression screen on our website. And if you screen positive or screen in based on your symptoms and what you're reporting, it can actually help to connect you with free mental health resources, including telehealth, which is critically important at a time like this, because it's not always easy to get into the doctor's office or to get in to see somebody. And sometimes it just helps to have somebody to talk to. So I would strongly urge you all to consider doing that.
Yeah, and so again, go to 9healthfair.org, click on eTools, you'll find those free screenings there. Tracy, as we talk about resources, can you talk about the financial resources that are available? You're the Medicaid director for the state of Colorado.
Yes, I work for the Department of Healthcare Policy and Financing, and we administer 2 different programs, the Medicaid program and the CHIP program. CHIP is a program that serves children, low-income children, and Medicaid is a program that serves low-income adults or people with disabilities. And the Medicaid program has a very rich benefit package for people who qualify for the services. In addition to individual and group therapy, it covers things like screening services, as were mentioned. It covers inpatient care, residential care, community mental health centers, which are a critical partner for our system, provide a variety of tailored services for people with significant mental health conditions. And during the pandemic, more people than ever are qualifying for these programs. As people get unemployed, often they are able to qualify. It may not be top of mind because they are focused on, thinking about rent and mortgages and things like that, but encourage people whether they have a mental health condition or not, but find themselves in a position where they need insurance coverage and they've lost it because they've lost their job, to apply to Medicaid. You can find information about applying at colorado.gov/peak. And I assume you'll put those in the link as well.
Yeah, once I get a handle on talking to all of you and kind of managing the screens and the Facebook comments, I will be posting some of these resources in the comments, and so will my coworkers at 9Health as well. Jason Youngblood, is with Cigna, and he's a mental health professional, licensed professional counselor. We kind of talked a little bit about resources. Let's talk a little bit about, how to manage your mental health during this time. You've talked with us about the mind-body connection before. It's not just physical health, but mental health. We really need to take care of our whole selves right now. Talk a little bit about why that's important in times like this.
Yeah, Robert did a great job when he was speaking about that mind-body connection. He mentioned sleep, and I will tell you, my sleep has been completely disrupted. The other night, for no reason, I woke up at 2 ready to take on the world and maybe didn't get back to sleep. And so for me and myself, I notice when my sleep is disrupted for more than a day or two, I tend to get a little bit irritable and I tend to be an anxious person. And so that's an example of how your mind and your body are connected. And if so, you're thinking sleep and sleep hygiene is really important. What you eat and drink is really important, and the amount of activity that you get also really important. So if you tend to be really anxious, if you're watching the news in the evening, be aware of other things that you put in your body, like caffeine, like soda, like coffee and tea. I love coffee, but lately I've had to make a conscientious effort to cut back when I started to feel a little bit anxious or overwhelmed. And so I think that paying attention to how your mind and body are related. The other thing that I would call out is that physical activity is really important, and that we can burn off a lot of extra energy. As I mentioned, I tend to be very anxious. And so when I'm anxious, I try to get activity. And if you've ever had a dog or a cat that has been a puppy or been troublesome and you've called the vet might have said to you, take them out, make sure they're getting activity, make sure they're running. And that does really help a lot. And we are mammals, we're not that different. And so putting it all together, our sleep and our eating and the activity that we get, really at times like this can help moderate our mental health issues and make us feel well.
Yeah, every time we do something on mental health, everyone talks about the importance of sleep. I have a 5-month-old and he's not gotten that memo yet. So I'm really struggling with this whole getting a lot of sleep thing right now. And I think, as you talked about too, getting up at 2 a.m. and I think the separation of work and our other part of our lives right now is kind of hard, since a lot of us are doing that at home. We're able to do that from home, which is a good thing, but also can be, I think, hard on your mental health. Lieutenant Governor, I want to go back to you for a little bit and talk about, the resources that the state has. We've mentioned, the Colorado Crisis Services. I'll put that in the comments, but also just, can you talk about how we can maintain good mental health right now? The governor switched from, stay at home to safer at home, so it's slightly looser restrictions, but obviously staying home is still the safest option, even if that is kind of hard on our mental health.
I think many factors, as Jason said, contribute to our mental health, and developing good mental health habits helps people become more resilient to ups and downs, and especially during times like this. So as much as we can, staying positive is key. Looking for silver linings, expressing gratitude. Once upon a time, I started a gratitude journal, and every day I have to put 3 new things in that I'm grateful for, and that really has helped maintain my mental outlook. Maintaining and valuing our personal relationships is important, and being kind to ourselves, especially during this time. As Jason said, it's important to eat well, exercise regularly, take breaks, decompress. Taking daily walks around my neighborhood helps me stay fit. I was out this morning getting some fresh air and listening to the birds singing and looking at the beautiful blue sky that we have now. I like to spend time with my daughter and granddaughter, who have just moved in with me, and my daughter's pregnant with twin boys. So I understand the sleep thing is going to be a disruption for me as well. So a lot of people also find that meditation and other mindfulness techniques help in decompressing from stress. So it's really important also to connect with friends and family. I try and FaceTime my other daughter every evening. So having a strong network can help get through these tough experiences, especially now. So I encourage you to video chat, call loved ones for support, And we can get through this, I think, by leaning on one another. As it's been mentioned, the state's worked hard to expand telehealth services to make sure Coloradans can get the care that they need for both physical and mental health care in the comfort of their own homes, which is important to stay healthy physically. So in Colorado, telemedicine can be delivered through video meetings, phone calls, and chat such as Google Hangouts, Facebook Messenger, FaceTime, or Skype. So telemedicine is an easy way to get mental health care when we need it.
Yeah, I'm looking at all the comments. Congratulations to your family as well. That's very exciting. But yes, less sleep is on the way for you as well.
Yes.
So it has a good trade-off, I think. But yeah, take care of your mental health in other ways because sleep will not happen. I'm looking at the Facebook comments. People are just talking about, get outside, do other things for your mental health. A lot of people are really just stressed financially. Tracy, maybe you can talk a little bit about dealing with, that financial stress, and maybe people are able to stay home right now but aren't able to get out and work. So just ways of dealing with that financial stress and maybe getting coverage if they need it for health insurance.
Yeah, as I said, we find it common that when there are large waves of unemployment, we see more people enrolling in Medicaid, and we expect that, and we're ramping up so that we can support people. People can apply online. They don't need to leave their home. An application through Peak, if it's an uncomplicated application, could take 45 minutes. And it could really relieve a lot of stress related to the financial burden associated with healthcare coverage. So again, we really encourage people, if they've had a change in financial circumstance or they just didn't know the program was available, to check it out on colorado.gov/peak.
And then Robert, I wanted to ask you, we're talking about financial stress, things that are causing stress and are, hurting our mental health right now, but when should people seek help? When is it an issue? And for those considering treatment, what does that look like? Can you talk a little bit about that?
Sure. People should get help when they see that their daily lives are being interrupted, or as Jason mentioned, their sleep, excessive use and substance use, uneasiness, unrest, feeling overwhelmed. It's always better to get help earlier than later. It's always better to not hesitate. I think folks, when we talk about anti-stigma, really should feel comfortable in knowing that mental health is a healthcare delivery. And people should look at it as they look at taking care of their heart. They should take care of their minds. So they should absolutely reach out for services. And if you don't know where to go, call the crisis line. They will connect you, put you on the right path and the right direction for substance use or mental health services.
And Jason, maybe you can chime in on this a little bit as well, when to seek help, but then also for loved ones that are living with family members right now, we're around each other more than maybe we're used to, but how to recognize signs in someone else and start that conversation about getting help with someone else.
Yeah. I think Robert said it exactly. If you're finding your daily activities disrupted, you're not able to do the things that you do every day. So if you're taking care of pets and you're not meeting their needs, if you're taking care of loved ones, children, if your work is disrupted, those should be red flags. I think the other red flags to listen, just to go off in your own mind, if those around you mention that they're concerned about you, sometimes it's our human nature maybe to get a little defensive when somebody says that to us, but you know what, it's okay, be a little defensive, but accept the red flag and maybe consider that as a sign that you should get treatment or support. And that can look like a lot of different things right now. There's lots of virtual support groups through the Mile High United Way. You can call 211 or go to 211.org and get access to resources or additional support, talk to people, maybe through your health insurance. But with Cigna, we offer virtual apps to focus on peer coaching. So you can do it anonymously with a peer. There are resilience apps. So maybe the concept of getting treatment, broaden what your definition of that is. There's lots of things that you can do to make yourself feel better that maybe doesn't mean that you're going to be talking to someone like me. But talking to someone like me, not that bad. Actually, hopefully can be pleasant for you.
Yeah, and I think many might find comfort in the whole telehealth thing too as well. And I know, Jason's with Cigna, and I think you've waived there used to be a requirement through many insurance. You had to go in person first before they'd cover telehealth visits, but right now a lot of insurance companies are waiving that requirement. So you can start with telehealth right away.
Absolutely. Yes. And, just kind of, I think, what to expect virtual health or telehealth, it could come in a variety of forms. Maybe you'll just talk to somebody on the phone. There might be people who are comfortable with that. I don't love the video medium. It makes me a little self-conscious, but maybe folks would like to do more of that video conference, or maybe even there's text to talk or text therapy as well that's coming online. Organizations like Talkspace are doing that. So I think what you can expect if you reach out and you schedule an appointment, probably that first appointment, you're going to just be asked, like, what's going on. You're going to be able to tell your story, to be heard, and then to figure out what is it that needs to happen to make you feel better. So it should actually be not a scary experience at all. It should be a nice, comfortable experience, but I think it's good to know what to expect with that.
And Dr. Coley, I want to talk about, recognizing others needing help with you as well. You're a physician, and I think a lot of us have family members that are maybe on the front lines, healthcare workers, and it's hard for a healthcare worker, a physician, nurse, maybe to realize that they need help as well. Can you talk a little bit about just being a physician and maybe helping them recognize when they need help as well? They're used to helping others, but.
Yes, absolutely right. And I think the stigma for physicians is especially real because a lot of physicians and healthcare workers worry that it labels their ability to deliver effective care, or it's a sign of weakness. And also we're taught when we're in medical school and in our training that we really need to put aside our own problems, put away our baggage, check it at the door when we come to take care of patients. And in this pandemic, we have to recognize that every single one of us is human, including the healthcare workers that are taking care of you, the grocery store workers, the ones that, pick up our garbage, the ones that deliver our mail. And we really have to have that compassion and empathy. So I think the first piece of advice I would give is to have your antenna up, not just for yourself, but for others as well. Because as Jason, Robert, and others have talked about, it's something that can really sneak up on you. The second piece of advice that I would give is don't let the small problem become a big problem. We're seeing this a lot with healthcare in general, which is that people are postponing a lot of routine things, whether it be, hypertension management, cholesterol management, diabetes management, because we're having to stay out of the doctor's office. But with mental health, a smaller problem is much easier to address than a bigger one. And I really think about it like a fire. You have a toaster oven fire that's much easier to put out. Once it starts getting involved and taking over the house, it's going to be very difficult to battle. So I've seen a lot of people, including colleagues, say that, oh, I'll address this after the pandemic is over. And with the timeline that we've got, which could be months to years, before we get our lives back to normal, so to speak, it is important to address it today and not wait till tomorrow or the day after or next week, because you start letting that horse out of the barn and it could really get away from you. And then the final piece of advice that I would give is kindness, self-kindness, as well as those to others, to really try to recognize that this is an unprecedented situation. And a lot of people who've never had mental health problems before may experience them for the first time because of the economic pressures or the psychosomatic pressures or the fear of the virus or those types of factors. And I think that it's important to understand that those are normal physiologic sensations. But again, if they start interfering with your functioning, that's when it's time to seek help. So have those antenna up, really address the problem early, and be kind to yourself. And as Lieutenant Governor said, a gratitude journal is a fabulous thing. I do that as well. And it's a really important way to plant apple seeds so that you get an apple tree. So positive seeds will lead to positive outcomes. And we get so much negativity, with all that information out there and all the worry and fear, that I think that that's a really important way to turn that around.
Yeah, I think that's all great advice. And and thank you for mentioning the other frontline workers as well, grocery store workers, people picking up our trash, delivering mail. There are a lot of people right now that are still working that are essential, and we are grateful for them. And shifting a little to talk about coping, Robert, a lot of people are turning maybe to substance use to cope. Today's Cinco de Mayo, so maybe someone's going to have a beer to celebrate, but when is it a problem, and what services are available for those that are struggling with substance use?
Yeah, I mean, it's a problem when it starts interfering with your daily life function, just like mental health concerns, substance use concerns, where you're using to the point that it's interrupting and disrupting your daily life functions and your daily responsibilities and the things you do in your day-to-day, or you have a hard time just stopping. You find that you can't stop, and you're sort of always have that urge for the substance. So I will say first, services are still open. I want that message to get out, even though we are in this pandemic and a safer at home concept. Services are still open. Services are still out there. That crisis number is good for substance use as well. So if you need to find a substance use provider, call the crisis hotline and they will get you connected with substance services.
Thank you for that. And Lieutenant Governor, just kind of want to come back to you as well. And, you know, people have come on and off our Facebook Live, but just let you say once again, you know, how the state has really put an emphasis on mental health and ways people can get help right now. Because like Robert said, you know, things are still open. You can still get the help you need.
Yeah, that's correct. And I'm glad Robert mentioned that. And as I mentioned before, we did start the Behavioral Health Task Force, and we've got hundreds of people taking a look from top to bottom at our mental health system to see how we can improve services for people. So that's something that we've been working on even prior to COVID. We've also made some pretty big steps to integrate physical healthcare practices, because we realize that you can't just treat somebody from the neck down, that you have to treat the whole person. So the state's done lots of work in that arena to make sure that people do get whole person care. So it's something that we're not finished with. The Behavioral Health Task Force will come up with recommendations in August in terms of what kinds of things we need to do to make it a more effective mental health system. So stay tuned, because there's more work left to come.
Yeah, thank you for sharing that. And I want to thank all of you for joining us today. I told you I'd keep you about a half hour, so that I've done that. I'm going to try and let you go here. If anyone has additional questions, you can post those in the comments and I can get those answered by our experts. I did want to mention once again that before we go, a reminder that it is Giving Tuesday. 9Health is a 501c3 nonprofit. We do depend on your donations to help us do this work. Community First Foundation is helping individuals support Colorado nonprofits. You can go to coloradogives.org/9health fair. We put the link in the comments. And there's many ways to give back right now to support 9Health and other nonprofits in Colorado. There were other resources mentioned during this Facebook Live, Colorado Crisis Services. I'll put that, Mile High United Way. I'll put you know, all those in the comments. The Medicaid resources that Tracy mentioned, I will put those in the comments as well, so that you can have those resources. And if you have a health question right now and you didn't get to ask it, or you need to give, or you know someone else, I guess, that can't tune into our Facebook Live to ask questions, you can call our 9Health Neighbors line at 303-698-4455, extension 2005. Leave a message with your health question, and a 9Health medical volunteer will give you a call back within 24 hours. You can talk to a real person, kind of the telehealth concept, get your medical questions answered, and yeah, just talk to someone. Thank you everyone for joining us. I'm going to sign off now, but I wanted to say thanks again. And again, if you have comments or questions, post those and we'll get them answered for you. Thanks so much, everyone.
Thank you.
Thank you.
Thank you.